gastric tubes and abdominal catheters are used for kanang pag-give og nutrients sa atong body and pagpagawas og mga kuan sa atong body. Like, if dili kaya jud sa patient or the person dili kaya mutulod, that is when we will use kaning mga gastric tubes na to. So we have here examples of level tube, a fairly small single lumen tube with a plain tip, and it may be visualized radiographically. Elbow tube used when an emergent condition exists there that requires large amounts of gastric contents to be aspirated quickly. Mo na akong ingon na need ipagawas per dili kayo sa patient. So when emergent condition requires large amount of gastric contents to be aspirated quickly. And then we have the levacuator tube also be used for evacuation of gastric contents. This is a wide double lumen tube placed through the patient's mouth. Next. Okay, we have the enteral tube, a small caliber tube used to deliver a liquid diet. So this is part of those nga gigamit para maka-deliver og kuan sa atong body. Directly to the duodenum and jejunum, it most commonly has a weighted end to hold the tube in the proper placement. Next is nasogastric decompression tube used to remove gas and fluids in the prevention and treatment of the abdominal distension. This is an image kana awa makita nimo ang gastric tube. Also, radiologic technologists uses this modality to view ug asa nadapit ang atoong tube nga gi-insert. Okay, that's all for me. Oh, napadi ay. This is the Miller-Abbott tube, a long tube, double lumen intestinal tube with a balloon. At the tip, kabantay mo ng balloon sa tip, yan na siya. Ginayos mo na siya to widen kanang nagani blockage or nagkuan ang atoong sa gas kanang sa atoong tract gani. If magkuan na siya, ginayos na siya to inflate, then i-deflate ko na siya pagkuan na. Then, they've used to treat intestinal obstruction by decompression. Harris and Cantor tube are other types of decompression tubes unlike the Miller-Abbott tube. However, the Cantor tube and the Harris tube contain a single lumen, double lumen, and then can be single lumen. Next. Okay.
So, hello everyone. Okay pa mo, Dira? I hope okay pa mo. Padayon ta. So, I will tackle about congenital and hereditary anomalies. So, first is the esophageal atresia. Atresia is a congenital absence or closure, a normal body orifice or tubular organ. So, when we say atresia, it is the blockage or kanang sarado ang ato ang normal passage or opening sa ato ang body. And then, esophageal atresia. It is a rare congenital anomaly in which the esophagus fails to develop past some point, resulting in discontinuation of the esophagus. So when we say discontinuation of the esophagus, meaning ang atong esophagus is na-block po siya, which is it is not directed or it is not connected sa ato ang stomach. So causes. Congenital absence or closure of the esophagus due to defective development of the trachea and esophagus, often associated with a tracheoesophageal fistula. So ang cause, an example, if a baby tries to drink a milk, so since ang ato ang food pipe or ang ato ang esophagus is supposedly it is directly sa ato ang stomach, pero in this case, the milk, if ang baby will drink of milk, ang milk, it will not go down all the way. So, ma-stuck siya or mabalik sa taas, causing, which it leads to choking, coughing, or bubble of the mouth. So, symptoms, it is visible after birth. So, excessive salivation, choking, as what I said earlier, gagging, dyspnea, cyanosis, inability to pass an empty tube into stomach, risk of aspiration, pneumonia. And for the treatment, of course, immediate surgery is the top priority and then continuous action. So the imaging modality for esophageal atresia is, for the radiography, it is a chest abdominal X-ray with radiopaque and the tube, shows termination of tube, contrast studies if aspiration risk is managed. So sa atong treatment, the surgery is done right away to connect the food pipe properly or atong esophagus para mo-direct ang food sa stomach. So, tracheoesophageal fistula, under ni siya sa esophageal atresia. So, tracheoesophageal fistula, this consists of an atresia at the level of the fourth thoracic vertebra with a fistula and abnormal tube-like passage from one structure to another to trachea. So, we have 5 types of esophageal atresia and tracheoesophageal fistula. So, sa type A, muna siya ang pure esophageal atresia, which is now fistula. So, as you can see, upper and lower part sa ato ang esophagus are not connected to the stomach. So, there is no opening and dili madiretso ang makita dyan na dili madiretso ang food directly sa atong stomach. Next is the type B, which is the esophageal atresia with proximal tracheoesophageal fistula. So, the upper part of the esophagus is connected to the trachea, while the lower part is blindly not connected. So, kani siya nga type, muna siya ang very rare na esophageal atresia sa PE fistulae. Then sa type C, which is ang katulong nga image, so the upper part of the esophagus ends blindly and the lower part is connected to trachea. So kani siya nga esophageal atresia. This is the most common with I think 80 to 90%. Or about 85 to 90% esophageal atresia. And next is type D, esophageal atresia with both proximal and distal tracheoesophageal fistula. So both upper and lower ends of the esophagus are connected to trachea. So this is also very rare and more dangerous because air and food can pass both ways, leading to choking and infection. And then lastly is the isolated H-type tracheoesophageal fistula. There is no atria, but there is an abnormal opening shaped like an H between the trachea and esophagus. So as you can see, nagforma daw siya og letter H. And the baby, a reason that ang dili makakaon properly ang baby. And some food or liquid can slip into the lungs, causing coughing or pneumonia. So, tracheoesophageal fistula, a gastronomy tube, may be placed in the infant's stomach to prevent reflux of gastric secretions into the trachea through the fistula. Okay, next is the bowel atresia. So we have 3 types of bowel atresia. It is ileal atresia, duodenal atresia, and then the colonic atresia. When we say bowel atresia, it means it is the blockage sa ato ang intestine. It prevents the normal passage of food and digestive fluids. So which is a part of our intestine is blocked or closed off. So ang atong food kay dili siya makapass through. So next, please. So first type of bowel atresia is ileal atresia. Ileal atresia, a congenital discontinuation of the ileum, is the most frequent type of bowel atresia, is followed by the duodenal atresia. So, may I ask if nakasabot ra mo og unsa ang ileal atresia? Kasabot ra. So, I will explain. Ileal atresia, muna siya ang blockage sa atong ileum sa lower part of the